Hello, and welcome to Vaccines, the Families You Serve, and You, the Basics. My name is Brianne Van Dyne, and I'm the Education Manager for Nevada's only statewide nonprofit dedicated to immunizations, Immunize Nevada. Along with Dr. Pam Forrest, Quality Assurance Manager for the State Immunization Program, I'll be conducting today's presentation. Immunize Nevada and the Nevada State Immunization Program recognize the unique needs of human service professionals who work with vulnerable populations. You are tasked with numerous responsibilities, one of which is to ensure that the parents, caregivers, and children you serve are safe and healthy. Using the guide developed by Vaccinate Your Family, the next generation of Every Child by Two, a national nonprofit organization committed to reducing the burden of vaccine-preventable diseases, and in collaboration with the Nevada State Immunization Program, our coalition has developed this training for Nevada WIC programs to help you and the families you serve be educated regarding the importance of immunizing. Before we officially begin the presentation, let's review our goals for what we hope you'll learn today. First, we'll review some key messages we feel are important to relay to parents and caregivers regarding vaccines, including why are vaccines important, what happens when we delay vaccinations or don't vaccinate our children, how can we protect ourselves, our families, and our communities, and are vaccines safe? Next, Dr. Pam Forrest will provide an overview of vaccines and the diseases they prevent. And then finally, we'll discuss some details regarding checking the immunization status of participants and provide some resources for where to make referrals, as well as where to access information for parents who'd like more information about the importance of immunizing. So key message number one, why are vaccines important? First and foremost, vaccines save lives. Vaccines offer the best known protection against a number of devastating illnesses, but they must be given according to the Centers for Disease Control and Prevention, the CDC's recommended immunization schedules in order to best protect children, adolescents, and adults. Second, large outbreaks continue to occur in the US. 2 vaccine-preventable disease outbreaks have occurred in recent months regarding measles and pertussis. Measles is a very contagious disease that can cause serious health complications, hospitalizations, and even death. According to the CDC, so far in 2019, there had been 1,250 cases of measles in 31 states. Travelers with measles continue to bring the disease with them into the US and spread it to others. The majority of people who got measles during the recent outbreaks in the US were unvaccinated. Large outbreaks of pertussis, also known as whooping cough, continue to occur in the US as well. Infants under 1 year of age are at the greatest risk for serious illness and death from pertussis. There were approximately 19,000 cases of pertussis reported to the CDC in 2017 and over 13,000 cases in 2018. To reduce the risk of pertussis in newborns, pregnant women should receive a Tdap vaccine during the 3rd trimester of every pregnancy. If we stop vaccinating, the limited number of vaccine-preventable cases we have, disease cases we have in the US, could very quickly become tens or hundreds of thousands of cases. Another reason vaccines are so important is that young children and pregnant women are at high risk of severe flu and its complications. During the 2018-2019 influenza season, 138 pediatric deaths due to flu were reported to the CDC. Flu vaccine can be life-saving for children. In 2017, a study showed that flu vaccination can significantly reduce the risk of a child dying from flu. Flu vaccine has also been shown to help protect women and their babies during and after pregnancy. So key message number 2, what happens when we delay vaccinations or don't vaccinate our children? Parents who obtain vaccination exemptions for their children are putting their children at risk for serious diseases. For example, studies have shown that children with exemptions are 22 times more likely to get measles than non-exempt peers. Parents who choose to delay vaccines or not vaccinate their children are also putting others and in their communities at risk. Diseases can travel quickly through a community and make a lot of people sick. However, when enough people are vaccinated against a certain disease, the germs can't travel as easily from person to person, and the entire community is less likely to get the disease. This is known as community immunity or herd immunity. In order to protect everyone in the community, including those who cannot be immunized from vaccine-preventable diseases, immunization rates must remain high. So key message number 3, how can we protect ourselves, our families, and our communities? First, immunizing yourself can protect others around you from getting dangerous vaccine-preventable diseases, especially young babies who have not yet received all of their vaccines and those who cannot be vaccinated due to medical reasons. We must each do our parts to limit everyone's exposure to disease. Just as you count on others not to knowingly expose you to dangerous illnesses, they rely on you. Second, encourage the moms you encounter daily to vaccinate themselves with Tdap and flu vaccines while pregnant. When a woman gets vaccinated against flu and pertussis, also known as whooping cough during pregnancy, they are not only protecting themselves, but they're giving some early disease protection to their babies. When a pregnant woman gets vaccinated, antibodies are transferred from her developing baby or to her developing baby, protecting the newborn for first few months of life. However, this immunity decreases over time. That's why infants need to be vaccinated according to the CDC's recommended immunization schedule to stay protected against 14 serious and potentially life-threatening diseases. It's important to note the CDC and the American College of Obstetricians and Gynecologists and the American College of Nurse Midwives all strongly recommend flu and pertussis, Tdap vaccinations for pregnant women. Another method of protection is to advise parents to request that anyone who will be around their newborn, including childcare providers, friends, and family members, be up to date on their pertussis or Tdap and flu vaccinations at least 2 weeks before meeting the new baby. Lastly, it's incredibly important that you use and encourage the families you serve to use credible sources when getting information about vaccines and overall health. Credible organizations include their family doctor or pediatrician, the CDC, the American Academy of Pediatrics, the Vaccine Education Center at the Children's Hospital of Philadelphia, Vaccinate Your Family, and us, Immunize Nevada. We'll also be providing the list of these resources at the end of this presentation. Why is it important to follow the recommended immunization schedules? Doctors, scientists, and public health experts work to develop the childhood and adult vaccination schedules in the U.S., giving people of all ages the most effective and safest protection from diseases possible. By following the CDC's recommended immunization schedule, parents can help give their children immunity before they are exposed to potentially life-threatening diseases. Non-standard vaccine schedules, which are not tested or approved by experts, put children at risk. It is not advisable to skip or delay vaccines, as this will leave a child susceptible to diseases for a longer period of time, a practice that can prove deadly for vulnerable infants. If a baby is not too young to get the disease, he or she is not too young to get the vaccine. Are vaccines safe? Since vaccines are given to healthy people, they go through a more rigorous approval process than drugs that are given to cure sick people. It typically takes many years and an average of $1 billion to thoroughly test a new vaccine. Before a vaccine can be considered for approval by the FDA, a vaccine manufacturer must show it's safe and effective through clinical trials. Concerns about the safety of vaccines and the possible link between vaccines and autism and vaccines and other health conditions are not supported by scientific evidence. No credible scientific study has ever found a link between vaccines and autism. In fact, Andrew Wakefield, the researcher who made this initial claim, has since had his medical license revoked. Wakefield's study, which was proven to be falsified, has been retracted from the journal that originally published it. After a vaccine is licensed by the FDA and recommended by the ACIP, there are 4 systems in place in the US that work together to help monitor the safety of vaccines and identify any rare side effects that may have been found in the clinical trials. The most commonly known monitoring system is the Vaccine Adverse Events Reporting System, or VAERS. VAERS is a passive reporting system co-managed by the FDA and the CDC. That means it relies on individuals to report vaccine reactions. Anyone can report an injury or reaction, including healthcare providers, patients, and patients' representatives, such as caregivers or attorneys. However, it is important to note that VAERS data alone can't be used to answer the question, does a certain vaccine cause a certain side effect? This is because adverse events reported to VAERS may or may not be caused by vaccines. There are reports in VAERS of common conditions that occur just by chance after vaccination. The three other safety monitoring systems include Vaccine Safety Data Link, or VSD. VSD is a collaboration between the CDC's Immunization Safety Office and 8 healthcare organizations across the country. It conducts studies based on questions or concerns raised from the medical literature and reports to VAERS. In addition, when new vaccines are recommended or if changes are made in how a vaccine is recommended, VSD will monitor the safety of these vaccines. The next system is the Clinical Immunization Safety Assessment Project, or CISA. CISA is a national network of vaccine safety experts from the CDC's Immunization Safety Office, 7 medical research centers, and other partners. CISA addresses vaccine safety issues, conducts high-quality clinical research, and assesses complex clinical adverse events following vaccination. It also connects clinicians with experts who can help consult on vaccine safety questions related to individual patients. And lastly, the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, a partnership between the FDA and leading health insurance companies helps make PRISM possible. It also provides access to information for over 190 million people, allowing it to identify and analyze rare health outcomes that would otherwise be difficult to assess. It's important to note that if a relationship between a side effect and a vaccine is ever found, the scientific community is alerted while the vaccine safety is reviewed. The vaccine may be temporarily or permanently suspended from use. What is in a vaccine? So the main ingredient in vaccines are antigens, which are small amounts of the bacteria or virus against which the person is being vaccinated. Antigens are the parts of a vaccine that encourage your immune system to create antibodies to fight against future infections. To make sure the vaccines cannot cause the disease you are trying to protect against, the antigens are altered or weakened. Like many of the foods we eat and beverages we drink, vaccines also contain a small amount of additional ingredients, and each has a specific necessary function. In addition to antigens, vaccines contain antigens that train the immune system to clear disease-causing germs, bacteria or viruses from the body quickly before they can cause serious illness. Adjuvants that help strengthen the immune system's response to the antigens and vaccines. Some cases, this means fewer shots are needed for the child to be fully protected. It includes stabilizers that are usually sugars or oils that prevent vaccines from going off or sticking to the sides of the containers or syringes, and residues that are tiny amounts of substances that remain in the vaccine after the manufacturing process. Most of these substances are removed from the final vaccine product, but small amounts remain. In such minuscule amounts, these residues are harmless and most are already present in our bodies. The last vaccine ingredient is a diluent. A diluent is used in vaccines, is usually sterile water or saline, salt water. Diluents have no effect on the body, and they are included in vaccines to ensure that the smallest useful dose can be given to children. These ingredients may be added to the vaccine to make it more effective, sterile, or safe. These additional ingredients have been studied and are safe for humans in the amounts used in vaccines. Now that we've reviewed some of the key messages regarding the importance of vaccinating and the safety of vaccines, Dr. Pam Forrest, Quality Assurance Manager with the Nevada State Immunization Program, will provide an overview of vaccines and the diseases they prevent. Thank you, Dr. Forrest.
Thank you, Glenn. The first of the vaccine-preventable illnesses that we'll talk about is diphtheria. Diphtheria is a serious bacterial disease that causes heart and nerve problems. The disease can be spread from an infected person or someone who carries the bacteria but has no symptoms by coughing and sneezing. Diphtheria can also be spread by contaminated objects like toys. A person can spread the disease for up to 2 weeks after infection. The diphtheria toxin can spread through the bloodstream to other organs and cause significant damage, such as injury to the heart, kidneys, and other organs. Nerve damage and paralysis can also result. Approximately 1 out of 10 people who get diphtheria dies from the disease. In children younger than 5 years of age, as many as 1 out of 5 who get diphtheria die. In the 1920s, there were 100,000 to 200,000 reported cases of diphtheria each year, and 13,000 to 15,000 people died from the disease. Since the introduction of the vaccine for diphtheria, the disease has dramatically declined. In the past decade, only 5 cases have been reported in the US. Signs and symptoms of diphtheria usually begin 2 to 5 days after a person is infected, and the symptoms are sore throat and hoarseness, painful swallowing, swollen glands in the neck, a thick coating on the back of the nose or throat. This coating can be whitish or grayish, and it makes it hard for the patient to breathe or swallow. Also, a mild fever of 100 degrees or less, 101 degrees or less, and chills occurs. The DTaP vaccine protects young children from diphtheria, tetanus, and pertussis, or whooping cough. The Tdap vaccine protects older children and adults against these 3 diseases. Next slide, please. The second disease that we're going to talk about is Haemophilus influenza type B. This is a bacteria. Do not confuse this with flu. Haemophilus influenza B, or also known as Hib, is a bacteria that causes serious illness and most often affects children under 5 years old. The most common types of serious Hib disease are meningitis, which is an infection of the covering of the brain and the spinal cord. Hib also causes pneumonia, joint infections, skin infections, bone infections, and bloodstream infections. And finally, it can also cause epiglottitis, which is a swelling in the back of the throat. Hib disease can cause lifelong disability and can be deadly. Even with treatment for Hib disease, as many as 1 out of 20 children with Hib meningitis die. As many as 1 out of 5 children who survive Hib meningitis will have brain damage or become deaf. Most children with invasive Hib disease need care in the hospital. Hib disease spreads when an infected person coughs or sneezes. Usually the Hib bacteria stay in the person's nose and throat and do not cause illness. This is also known as carriage. But the bacteria can spread into the lungs or blood and the person will become very, very sick. Hib causes different symptoms depending on which part of the body is infected. Fever, headache, confusion, stiff neck, and pain when looking into bright lights is a symptom of meningitis. Poor eating and drinking and vomiting can be a sign of meningitis in babies. Fever, chills, headache, cough, shortness of breath, and chest pain are symptoms of pneumonia. Fever, chills, excessive tiredness, and confusion are an example of an infection in the bloodstream called bacteremia. And finally, trouble breathing occurs when the Hib infects the epiglottis in the back of the throat, and you get epiglottitis. The Hib vaccine is the best prevention against this dangerous disease. Before the Hib vaccine was available, Hib caused serious infections in 20,000 children under the age of 5 and killed about 1,000 children each year in the United States. Since the vaccine's introduction in 1987, the incidence of severe Hib disease has declined by 99% in the United States. What a success story. The next disease we'll talk about is hepatitis A. Hepatitis A is a disease of the liver caused by hepatitis A virus. It can range in severity from mild illness lasting a few weeks to severe illness lasting several months. And many times when children are infected, they don't have any symptoms at all. Hepatitis A is usually spread by contact with people who are infected or from contact with objects, food, water, or drinks contaminated by the feces of an infected person, which can easily happen if someone doesn't properly wash his or her hands after using the toilet. Not all people with hepatitis A have symptoms. Adults are more likely to have symptoms than children. If symptoms develop, they usually appear 2 to 6 weeks after being infected. And the symptoms include fatigue, nausea and vomiting, loss of appetite, fever, dark Coca-Cola colored urine, gray colored stools, joint pain, yellowing of the skin and eyes, and finally severe stomach pains and diarrhea, which are usually the symptoms that we find in children. The hepatitis A vaccine is recommended for children and can prevent infection with the virus. Some adults with high risk of getting hepatitis A and its serious complications need hepatitis A vaccine also. Since the introduction of the hepatitis A vaccine in 1995, rates of the disease have been on the decline. However, since 2016, there have been large outbreaks of hepatitis A in 30 states, with approximately 27,500 cases, 16,500 hospitalizations, and 275 deaths. Hepatitis B is another contagious liver disease caused by the hepatitis B virus. For some, hepatitis B infection becomes chronic, leading to liver failure, liver cancer, or cirrhosis, a condition that causes permanent scarring of the liver. A person who is unaware that they have hepatitis B virus can pass the disease on to a baby when giving birth, so that spread from the infected mother to the baby. A person who has hepatitis B virus can pass the disease through contact between their blood from cuts or sores to another person, by biting another person, through sharing personal items such as toothbrushes, or from shared food that was chewed for a baby. I've been told that in many cultures, the food is chewed first and then removed from the mother's mouth and inserted in the baby's mouth. Not all people with hepatitis B have symptoms. Infants and children usually show no symptoms. However, if they occur, they usually appear about 3 or 4 months after infection and can range from mild to severe disease. The symptoms are, again, dark urine, fever, joint, muscle, and stomach pain, loss of appetite, nausea, diarrhea and vomiting, fatigue, yellowing of the skin and whites of the eyes. According to the CDC, up to 1.4 million people in the United States may have chronic hepatitis B infection. Each year, about 2,000 people in the United States die from hepatitis B related liver disease. The best way to prevent hepatitis B is by getting the hepatitis B vaccine. The first dose of hepatitis B vaccine should be given at birth before leaving the hospital. This vaccine acts as a safety net, reducing the baby's risk of getting the disease from mom or family member or other caregiver who may not know that they are infected with hepatitis B. Newborns that become infected with hepatitis B virus have a 90% chance of developing lifelong chronic liver infection. Therefore, many parents mistakenly believe that hepatitis B is strictly a sexually transmitted disease and are therefore reluctant to have their child vaccinated at the recommended ages. Next, we're going to talk about human papillomavirus. Most people, about 8 in 10 people, will get an HPV infection at some point in their lives. HPV is a common virus that can cause cervical, vaginal, vulvar cancers in women, and penile cancer in men. HPV can also cause anal cancer, throat cancer, and genital warts in both men and women. Nearly 80 million people in the United States have already been infected with HPV, and about 14 million people, including teens, become infected with HPV each year. In addition, every year in the United States, HPV causes 35,000 cancers in men and women. HPV vaccination can prevent most of these cancers from ever developing because the vaccine prevents infection, which leads to these cancers. HPV can be passed even when an infected person has no signs or symptoms. In most cases, HPV goes away on its own, and people infected with the virus never knew that they had it. However, when HPV does not go away, it can cause health problems such as genital warts and cancer. Genital warts usually appear as a small bump or groups of bumps in the genital area. A healthcare provider can usually diagnose warts by looking at the genital area. Cervical cancer usually does not have symptoms until it is quite advanced, very serious, and hard to treat. For this reason, it is important for women to get regular screenings for cervical cancer, in addition to getting vaccinated for HPV. Other HPV-related cancers might not have signs or symptoms until they are advanced and hard to treat. There is no routine screening for other HPV-related cancers for men and women. There is no screening for head and neck cancers. The HPV vaccine protects against HPV infections that cause most of the HPV-related cancers. HPV vaccine can also help prevent genital warts. All children who are 11 or 12 years old should get 2 doses of HPV vaccine. Teens and young adults through age 26 years, if not vaccinated already, should also get the HPV vaccine. The vaccine offers the greatest health benefits to those who receive both of the recommended doses before having any type of sexual activity. Some parents may be surprised to learn that sexual intercourse is not necessary for infection. Oral genital and hand genital transmission of some genital HPV types is possible. A person can become infected during their first sexual encounter. The HPV vaccine has been studied very carefully and continues to be monitored by both the CDC and the FDA. With over 100 million doses distributed in the United States, HPV vaccine has a good safety record that's backed by over 10 years of monitoring and research. Seasonal influenza is caused by viruses that infect the respiratory tract, the nose, throat, and lungs. It is not the same as the common cold, which is another respiratory illness caused by a different virus. The flu season is unpredictable, but it often occurs from between October and May and usually peaks between December and February. Certain complications of the flu can result in hospitalization or death, even in healthy children. Children are at a particularly high risk if they are younger than 5 years of age or have certain chronic health conditions. While the majority of deaths resulting from flu occur in the elderly during a typical flu season, rates of infection are highest among children, and hospitalization rates among children younger than 6 months old are similar to those of the elderly. Each year in the United States, more than 20,000 children younger than 5 years are hospitalized, and approximately 100 die as a result of the flu. During our past flu season, 2019 to 2020, 185 children died due to the flu and its complications. Common signs and symptoms of the flu may include a fever over 100 degrees Fahrenheit, muscles or body aches, chills, headache, cough, fatigue or tiredness, runny or stuffy nose, and a sore throat. The best way to prevent the flu is to get vaccinated. An annual flu vaccine is recommended by the end of October for everyone 6 months of age and older. To best protect children younger than 6 months old, it's important that all of their family members and caregivers be vaccinated. Adults, particularly pregnant women, also need to be vaccinated against the flu every year. Changes to a woman's immune system make her more likely to get serious flu complications. Also, the risk of premature labor and delivery increases when pregnant women get the flu, and there is greater chance of their babies having birth defects if the woman gets the flu. In addition, being vaccinated while pregnant has been shown to provide some protection to the woman's baby for several months after he or she is born. By getting vaccinated during pregnancy, mothers build antibodies that are transferred to the newborn, providing protection against influenza before the baby can start getting their own flu vaccine at 6 months of age. Once the baby is born, breastfeeding also will help the infant stay healthy during flu season. Breastfeeding protects babies because breast milk passes a mother's antibodies to her baby, which helps fight off the infection. Even though the flu vaccine varies in how well it works each season, getting the flu vaccine every year is still very important and has a lot of benefits. Getting the flu vaccine can keep you from getting sick with the flu, help you get back on your feet sooner if you do get sick with the flu, reduce the risk of children dying from flu, reduce the risk of serious flu complications like hospitalization for children and adults, help protect people around you, including those who are more vulnerable to serious flu illness and complications due to age and or certain chronic health conditions, and protect women during their pregnancy and after their pregnancy from getting the flu. Next, we'll go on to measles. Measles is a very contagious respiratory disease. Measles spreads when a person infected with the measles virus breathes, coughs, or sneezes. A person can catch measles by just being in a room where someone with the disease has been for up to 2 hours after that person is gone. And people infected with measles can be contagious even before they have the measles rash. Measles disease can be very dangerous, especially for babies and young children. 1 in 5 people with measles will be hospitalized. For some children, measles can lead to pneumonia, a serious lung infection. Measles can lead to lifelong brain damage, deafness, and death. Measles disease is common in other parts of the world, including countries in Europe, Asia, the Pacific Islands, and Africa. And over the past several years, measles has once again become a threat in the United States. Outbreaks across the country have put children at risk. In 2019 alone, there were 1,250 cases of measles in 31 states. If you suspect you or one of your family members has been exposed to measles, do not go to your doctor or healthcare provider. Instead, call the healthcare provider and explain the situation. Measles is highly contagious, and you or your family member could infect others in the waiting room if you have been exposed to the disease and have the disease. Your healthcare provider will be able to tell you the next steps to take to protect yourself, your family, and your community. Measles signs and symptoms appear 7 to 14 days after exposure to the virus. Measles starts with a fever that can get very high. Some of the other symptoms that may occur include cough, runny nose, and red eyes or pink eye. A skin rash of tiny red spots that start at the head and spread to the rest of the body. Measles can cause ear infections and diarrhea. To help prevent measles, children should be vaccinated with the measles, mumps, and rubella vaccine, also known as MMR. For the best protection against measles, children need to receive the 2 recommended doses of the vaccine. 1 dose of MMR is about 93% effective in preventing measles, and 2 doses are about 97% effective. The doses should be given between the ages of 12 and 15 months, and then the second dose should be given between the ages of 4 and 6 years. Almost everyone who has not had the MMR shot will get measles if they are exposed to the measles virus. Adults born during or after 1957 who have not had the measles disease or been vaccinated should receive at least 1 dose of the MMR vaccine. And some adults, especially those who are in healthcare, need to have 2 doses of the MMR vaccine. Meningococcal disease. Meningococcal disease is a serious bacterial illness and a leading cause of meningitis in children ages 2 through 18 years. Meningitis is an infection of the fluid surrounding the brain and spinal cord. Meningococcal disease can also cause bloodstream infections, and the bacteria that causes meningococcal disease spreads through very close or lengthy contact with an infected person's saliva. So examples of that would be sharing drinks and eating utensils, kissing, and living in close quarters. Also, coughing and sneezing can spread the meningococcal bacteria. Meningitis can strike without warning. It progresses quickly, and it can be fatal. U.S. college campuses have reported outbreaks of serogroup B meningococcal disease during the last several years. About 600 to 1,000 people get meningococcal disease each year in the United States, and 1 in 10 of these people die, sometimes within 24 hours after their symptoms appear. Of those who survive, about 1 in 5 people will suffer long-term consequences such as brain damage, hearing loss, loss of limbs, and nervous system damage. Children younger than 1 year old, teens, and young adults are at the greatest risk for meningococcal disease. The most common symptoms include high fever, severe headache, and a stiff neck. There are also usually additional symptoms, and they can include vomiting or nausea, confusion, seizures, sleepiness or difficulty waking up, sensitivity to light, cold hands and feet, severe aches or pain in the muscles, joints, chest, or belly, dark purple skin rash, which usually appears on the trunk and the arms and the legs. Babies may not have, or it may be difficult to notice the classic symptoms. Instead, babies may be slow or inactive, irritable, have vomiting. The baby may be feeding poorly or have bulging in the soft spot of the skull. 2 types of meningococcal vaccine are available. The meningococcal vaccine MenACWY has been available for several years and protects against 4 of the 5 types of meningococcal bacteria. The MenACWY protects against those 4 bacteria. It is routinely recommended for all children ages 11 to 12 years of age, with a booster dose provided at age 16. The other type of meningococcal vaccine, known as Men-B, is newer and protects against the 5th type of meningococcal bacteria. Men-B vaccine is routinely recommended for people 10 years and older who are at increased risk for serotype B meningococcal infections. When a child reaches age 16, a healthy child who reaches age 16 to 23 years, the meningococcal B vaccine can be administered to provide short-term protection. Parents should talk to their child's healthcare provider about the Men-B vaccine once their teen reaches age 16. Mumps. Mumps is a contagious disease caused by a virus. It is spread through coughing and sneezing and through close contact. Even regular conversations can pass it if you have a conversation with an infected person. The primary and best known sign of mumps is swollen salivary glands that causes the area at the angle of the jaw to puff out. While usually a mild disease, mumps can also cause complications such as meningitis, which again is a swelling of the brain and spinal cord, and mumps can also cause deafness. In addition, about 1 out of every 4 teenage or adult man who gets the mumps will develop a painful swelling of the testicles, which can, although rarely, lead to sterility. Even though the vaccine has drastically reduced mumps cases, mumps outbreaks still occur in the US. Outbreaks have most commonly occurred among groups of people who have close contact. Again, people who share water bottles or cups, people who kiss, people who practice sports together or live in close quarters. Some vaccinated people may still get the mumps even if they are exposed to the virus. However, disease symptoms are milder, much milder in vaccinated people. Some children infected with the mumps virus have no signs or symptoms, or they can have a very mild case. When signs and symptoms do develop, they usually appear about 2 or 3 weeks after exposure to the virus, and they include swollen glands under the ear or jaw, fever, headache, fatigue, loss of appetite, and muscle aches. To prevent mumps, children should be vaccinated with the MMR vaccine. For the best protection against mumps, children need to receive both of the recommended doses, one at ages 11 to 12 months, and then the second at ages 4 to 6 years. Pertussis, which is also known as whooping cough, is a very contagious respiratory disease caused by bacteria that spread easily from person to person through coughing and sneezing. In many children, it's marked by a severe hacking cough followed by a high-pitched intake of breath that sounds like a whoop. However, some babies with whooping cough only have a slight cough or no cough at all. Instead, the babies may have a hard time breathing or even stop breathing for short periods of time. Adolescents and adults with pertussis may have prolonged coughing spells that last for weeks or even months. However, the whoop sound may not be there, and the illness is generally less severe than in young children, especially in people who were previously vaccinated against pertussis. In fact, some adults who get pertussis may not even know that they have the disease. Pertussis is most dangerous for babies, as they are at a particularly high risk of severe complications, hospitalization, and death. About half of babies younger than 1 year old who get the disease need care in the hospital, and 1 out of 100 babies who get treatment in the hospital die from pertussis disease. Most unvaccinated children living with a family member with pertussis will get the disease. Pertussis is still common in the US, and outbreaks still occur. Recently, between 10,000 and 50,000 cases have been reported each year in the United States. Symptoms usually take between 1 and 3 weeks to appear. They're usually mild at first and resemble those of a common cold. After a week or two, signs and symptoms worsen. Thick mucus accumulates inside the airways, causing uncontrollable, severe coughing. Violent coughing fits may cause vomiting, a blue face from not getting enough air, difficulty breathing, eating, drinking, or sleeping. The coughing fits can cause broken ribs and gasping for air after a coughing fit. And this gasping may cause the whooping sound. For the best protection against pertussis, children need to receive all 5 recommended doses of DTaP vaccine. All adults and adolescents need to be vaccinated with a dose of Tdap. And now, Tdap can be given at any time tetanus booster is needed. And Tdap is the adult version of the DTaP of the diphtheria, tetanus, and pertussis vaccine. To best protect newborns from pertussis, pregnant women should be vaccinated with Tdap during every pregnancy. And that dose is usually given in the third trimester between 37 and 36 weeks of pregnancy. Family members and caregivers of an infant should also make sure to be up to date on their Tdap vaccination at least 2 weeks before coming into close contact with the baby. Next slide. Pneumococcal disease is caused by a bacteria called Pneumococcus. The disease is often mild, but can cause serious illness, lifelong disability, and even death. Pneumococcal disease is spread by coughing and sneezing. Types of pneumococcal disease include pneumonia, which is a lung infection, meningitis, a bloodstream infection called bacteremia, and sepsis. Pneumococcal disease can also cause middle ear infections and sinus infections. Children younger than 2 years old are most likely to have a serious case of pneumococcal disease. According to the CDC, each year in the United States, pneumococcal disease causes thousands of cases of pneumonia and ear infection. Additionally, about 2,000 cases of invasive pneumococcal disease occur each year in children under the age of 5 years in the United States. These illnesses can lead to disabilities like deafness, brain damage, loss of arms and legs. About 1 out of 15 children who get pneumococcal meningitis dies. About 1 out of 5 children with a bacterial infection in the blood will die from it. Symptoms depend on the type of pneumococcal disease, but generally include fever and or chills. In addition, they can have a cough with rapid breathing or difficulty breathing and chest pain, stiff neck, headache, confusion and pain when looking at bright light, poor eating and drinking, low alertness and vomiting are signs of meningitis in babies. Low alertness can come from bacteremia and sepsis. Ear pain with a red swollen eardrum and sleepiness are signs of a middle ear infection. Pneumococcal vaccines are the best way to prevent pneumococcal disease. For the most protection against pneumococcal disease, children need to receive all of the recommended doses. Next slide, please. Polio. Polio is a potentially crippling and deadly disease caused by a virus that spreads from person to person. It can invade the brain and spinal cord, resulting in paralysis. Before the polio vaccine was available, an average of 50,000 polio cases were reported in the United States each year. Polio was one of the most dreaded childhood diseases of the 20th century, with annual epidemics, primarily during the summer months. This often left thousands of victims, mostly children, permanently in braces, using crutches, wheelchairs, or in iron lungs. Because polio can paralyze the diaphragm, in the 1940s and the 1950s, entire wards of hospitals housed polio victims who were dependent on large iron lung machines to breathe for them. Polio can cause paralysis. Signs of paralytic polio include loss of reflexes, severe muscle aches or spasms, loose and floppy limbs, which is flaccid paralysis, often worse on one side of the body compared to the other. Polio does not always cause paralysis, and people with polio don't always show symptoms. If symptoms of non-paralytic polio appear, they may include fever, sore throat, headache, vomiting, fatigue, nausea, pain or stiffness in the back, neck, arms, or legs, muscle spasms, or tenderness. Since polio has no cure, polio vaccine is the best way to protect individuals, and it is the only way to stop disease from spreading. There are two types of vaccine that can prevent polio. Inactivated polio vaccine, which is what is used in the United States, is also known as IPV. And then in the rest of the world, some other countries are still using oral polio vaccine. Since 2000, only IPV, or the inactivated polio vaccine, has been used in the United States. But as you look at children's shot records from other parts of the world, OPV, or oral polio vaccine, is still being used throughout much of the world. Next slide. Next, we'll talk about rotavirus. Rotavirus is a virus that causes diarrhea and vomiting in infants and young children. It can lead to severe dehydration if not treated, and it can be deadly. Each year, rotavirus causes an estimated 450,000 deaths among infants around the world. Prior to the rotavirus vaccine, almost every child had been infected with rotavirus by age 5. Before the rotavirus vaccine was recommended in the United States in 2006, rotavirus sent 200,000 children to the emergency rooms, caused 55 to 70,000 hospitalizations each year, and caused 20 to 60 deaths. After a child has been infected with rotavirus, it takes 2 days for the symptoms to appear. The symptoms are dehydration because of a loss of body fluids, vomiting, watery diarrhea, stomach pain, fever, and loss of appetite. In adults who are otherwise healthy, a rotavirus infection may only cause mild symptoms and signs, or none at all. Vaccination is the most effective way to prevent rotavirus infection in infants. For best protection against rotavirus, children need to receive all recommended doses, which may be 2 or 3 doses depending on the brand of vaccine. And the rotavirus vaccine the first dose has to be given before the child turns 4 months of age. So it's important for you to refer these kids early so that they get started on the vaccine before they're 4 months of age. After 4 months of age, the vaccine cannot be administered. The first dose cannot be administered. All right, let's talk about rubella. Rubella is also known as the German measles. It is a contagious viral infection best known for its distinctive red rash. The virus can spread through coughing and sneezing. While the disease is usually mild in children and adults, rubella can be very dangerous for pregnant women and their babies. If a pregnant woman is infected with the disease, it can cause miscarriage, stillbirth, premature births, or birth defects such as heart problems, hearing problems, and vision loss. Also, intellectual disabilities can occur, and liver spleen damage can occur in the unborn child. This group of health problems is called congenital rubella syndrome. The symptoms of rubella are often so mild they're difficult to notice, especially in children. If symptoms do occur, they generally appear 2 to 3 weeks after exposure to the virus and last 2 to 3 days. The symptoms include a mild fever of less than 101 degrees Fahrenheit, a headache, stuffy or runny nose, inflamed red eyes or pink eye, enlarged tender lymph nodes. Rubella disease causes a fine pink rash that begins on the face and quickly spreads to the trunk and then the arms and the legs before disappearing in the same sequence. And aching joints can occur, especially in young women. To prevent rubella disease, children should be vaccinated with measles, mumps, and rubella vaccine, also known as MMR. In addition, women thinking about becoming pregnant may need to be vaccinated against rubella if they are not immune. Before the rubella vaccine was introduced in 1969, widespread outbreaks usually occurred every 6 to 9 months in the United States, mostly affecting children between 5 and 9 years of age. Between 1962 and 1965, rubella infections during pregnancy were estimated to have caused 30,000 stillbirths and 20,000 children were born impaired or disabled. In 2004, the CDC announced that both the congenital and acquired forms of rubella had been eliminated from the United States. The United States continues to vaccinate to prevent the possibility of rubella being imported from countries where it is still common. Tetanus. Tetanus is also known as lockjaw. Tetanus is a severe disease that causes stiffness and spasm of the muscles. Unlike other vaccine-preventable diseases, which are transferred from person to person, tetanus bacteria are found in places such as soil, dirt, dust, and manure, and can therefore never be eradicated. Tetanus bacteria enter the body through any break in the skin, such as a cut or a puncture wound. A person can also be infected after a burn or animal bite. There's no cure for tetanus. Treatment focuses on managing complications until the effects of the tetanus toxin resolve. Almost all cases of tetanus are in people who have never been vaccinated or who completed their childhood series but did not have a booster dose in the last 10 years. Fatality is highest in people who haven't been immunized. Up to 20% of reported tetanus cases end in death. The common signs and symptoms of tetanus include seizures, fever and sweating, high blood pressure or fast heart rate, difficulty swallowing, stiffness of muscles all over the body, painful muscle spasms strong enough to break a child's spine or bones. Vaccination is the most effective way to prevent tetanus. The tetanus vaccine for children, DTaP, also helps protect against diphtheria and pertussis or whooping cough. The adolescent and adult version of this vaccine is known as Tdap. Another vaccine for adolescent and adults is called TD, and that combines protection against tetanus and diphtheria, but not pertussis. For the protection against tetanus, children need to receive all of the 5 recommended doses of DTaP vaccine. Adolescents need a dose of Tdap at age 11 or 12 years of age. For older children, adults who haven't received a dose of Tdap yet, the easiest thing to do is get a Tdap vaccine. And now, adults can receive a booster dose of Tdap every 10 years or a booster dose of TD every 10 years. It would be better to request Tdap so that you're protected against pertussis. Next, we'll talk about varicella or chickenpox. Varicella disease is a viral infection that causes itchy, blister-like rash. Chickenpox is very contagious and can spread quickly to children who haven't had the disease or been vaccinated against it. Chickenpox can lead to severe illness with complications such as a bacterial infected blister, pneumonia, bleeding disorders, swelling of the brain, and even death. Once an individual is infected with the varicella virus, it remains in the body for life and may reappear as shingles once they are older. Before the chickenpox vaccine was approved in the US, approximately 4 million people got sick with the disease each year. About 10,600 people were hospitalized, and 100 to 150 people died every year as a result of chickenpox. In the 1990s, the highest rate of chickenpox illness occurred in preschool-aged children. Today, due to the vaccine, the number of cases and hospitalizations is down dramatically. Chickenpox infection usually lasts about 5 to 10 days. The most common symptom is the rash. It looks like dewdrops on rose petals. It's a thin-walled blister on top of a red spot. It usually appears first on the face and the chest and then spreads to the rest of the body. As many as 250 to 500 blisters and bumps may appear on the skin. Other signs and symptoms, other than the rash, appear 1 to 2 days before the rash, and they include fever, loss of appetite, headache, and a general feeling of being unwell. The varicella vaccine is the best way to prevent chickenpox. For the best protection against chickenpox, children need to receive the 2 recommended doses of the vaccine. Usually, it's given at ages 12 to 15 months for the first dose, and then the second dose is given at ages 4 to 6 years. Adults who have never had chickenpox or received the varicella vaccine should get 2 doses in order to protect themselves from a chickenpox infection and to protect those around them.
Great, thank you, Dr. Forrest. Now that we've finished our review of vaccine-preventable diseases and the vaccines that protect us against them, let's review Nevada WIC's policies and procedures for checking children's vaccination status. So when asked if a child is up to date, parents typically overestimate their child's vaccination status. That's why a documented record of vaccinations is far more accurate than an actual parent's memory. I know before I worked in immunizations, I couldn't tell you how many doses of what vaccine my child had received, especially when you have multiple children, it's difficult to manage. But per the Nevada WIC policy and procedure manual, the immunization status of all children under the age of 2 years will be screened at each certification period. So this would involve parents and caregivers providing you with proof of immunization records to each certification appointment. Documented proof includes, but is not limited to, their handheld immunization record. So this would include anything that's, their little folded up records with handwritten doses and dates, and information from an immunization registry like Nevada WIC here in our state. If the proof is not provided, the policies and procedures manual indicates that staff should continue to encourage parents and caregivers to bring immunization proof into the following visits. In Nevada, WIC staff can have their own Nevada WIC login to access immunization records for the purpose of checking to see if the children they serve are up to date. We will be providing you with that web address where you can access the form for gaining your own individual login for that purpose. So stay tuned for that. So while we're hoping that after taking all that time to learn about the value of vaccines and the various and serious diseases they prevent, you'll provide resources to educate and encourage parents and caregivers to immunize their children, the children in their care according to the schedule. Per the Nevada WIC policy and procedure manual, WIC staff at a minimum is asked to screen infants and children for Tdap immunization. By 3 months of age, the infant or child should have had at least 1 dose. By 5 months, that would be 2 doses, 7 months, 3 doses, and then by 19 months of age, the infant or child should have had at least 4 doses of DTaP. In 2003, the CDC, in cooperation with the USDA and National WIC Association, developed a simplified method for WIC staff to monitor vaccination status of children less than 2 years of age. The 4th dose of DTaP, diphtheria, tetanus, and acellular pertussis vaccine was chosen to be the marker to identify whether children were up to date or not on their vaccination. Use of this strategy increased the immunization rates of WIC participants since it was introduced by 10%. So what you're seeing on the screen here is an easy to use table that was developed as a part of that process to help you folks determine if a child is up to date based on their DTaP vaccination status. So just wanted to include that here as an easy to use tool. Also, it's important to note that if you are accessing children's immunization records, if they were immunized in Nevada, through Nevada WIC, you would be able to see this DTaP vaccination status along with their comprehensive immunization records as well. So now we're going to go ahead and move on to making referrals. So if after reviewing their immunization record, you've determined that a child is not up to date, we wanted to provide you with the resources for where to make referrals. So here you're seeing a screenshot from immunizenevada.org. That's our website there. Our website will be updated in a couple of months, so the interface will look slightly different, but the information contained on this slide and the screenshot from our website will remain the same. So what you do is by going to immunizenevada.org, you'll be able to look where clients in your care can take their children to get vaccinated. So this is partitioned by where to go if you're uninsured and where to go if you have health insurance. We have Southern Nevada and Northern Nevada resources or links there so that you can provide them with the appropriate clinic locations based on where they're located in Nevada. And then we also have a community calendar listed on our webpage that indicates certain kind of one-off vaccination clinics or events that are taking place throughout the state as well, if they're not established with a primary care provider. So we wanted to provide you as with this as a resource, just as at a quick glance for how to easily make referrals for those families and children. In addition, we've developed a couple of flyers at Immunize Nevada that are also available in Spanish. We are happy to send you these files. If you'd like, just go ahead and send us a message, or contact information will be the end of this presentation. But the one that you're seeing on the left-hand side is our Shots for Tots during COVID-19 flyer. So it's important to note that immunization coverage rates dropped significantly in the wake of the COVID-19 pandemic, which was the reason for developing this flyer. So this flyer discusses additional precautions that offices may be taking, pediatric offices, and general practitioners or just clinics are taking to keep children and patients safe during COVID-19. So a couple of these precautions that they're taking may be scheduling well visits in the morning and sick visits in the afternoon, wearing masks when seeing patients. There are numerous precautions that practices are taking in order to ensure that families are safe and protected from COVID-19. So these are, of course, the specific precautions that clinics are taking would have to be confirmed with, personal primary or personal care providers or doctors' offices. But this is a tool for you guys to use to disseminate to families who may be having a little bit of hesitation about immunizing or staying up to date with those wild checks during COVID-19. In addition, the flyer on the right is discussing resources where clients can go in Nevada if they are uninsured and want to access care or be immunized. So it discusses local health departments, rural health resources, federally qualified health centers. All of this information is also on immunizenevada.org, but this does a great job of putting it in a one-page document that is easy to reference and is also easy to provide to the families. So here you'll see a couple of different immunization schedules. I kept the childhood immunization schedule from birth through 6 years old larger because that's obviously going to be the ones that you folks will be using most often. I've also included just a smaller screenshot of the easy to read parent schedule for 7 to 18-year-olds as well. This is for the purpose of providing parents with an idea as to when those upcoming immunizations are coming, and then also if they have older siblings or children in their care, that adolescent resource for the schedule is really helpful as well. Just going to finish up with a couple of local and national resources that are reputable. We talked about at the beginning of the presentation the importance of searching out credible health information sources when we are discussing or trying to provide resources for parents where we're discussing immunization or just health topics in general. So what we've done here is that Nevada WIC address. This has a link on that web page for the public access portal for parents and patients. Patients can access their own immunization records online. They don't need to go or make a request of their primary care providers to pull those reports for them. So in the event that they're having trouble finding that paper record, this is a really great resource, and there's a printable handout available on that website as well as on immunizenevada.org to provide parents and caregivers should they want to access those immunization records. It's important to note that the immunizations that are included in Nevada WIC are only going to be immunizations that were conducted in the state of Nevada, or if their primary care providers were given historical immunization information from out of state or wherever the child was immunized last, and then entered that into the Nevada WIC system. So unfortunately, the state immunization information systems don't talk to each other to share that information. That would be amazing for so many reasons, but that's just an important caveat to note. And then also on that website, you'll be able to access the form for applying for read-only access for yourself for accessing those immunization records in the absence of that record being brought in to those appointments. The next resource is immunizenevada.org. We've already talked about a couple of different resources that are available on our website. In addition to what we've already discussed, there are vaccine hesitancy resources for parents and guardians in both English and Spanish from a multitude of trusted organizations and agencies, as well as ones that we have developed as an organization as well. There are Nevada-specific flyers about events, immunization coverage reports, and then information talking about vaccines specifically that are Nevada-specific on our website as well. And then also, again, just that calendar of immunization and health-focused events that is updated regularly. Third is vaccinateyourfamily.org. That was the organization who developed the content for this presentation. So immunization resources for parents and parents-to-be are also available on their website in English and Spanish. And then the guide from which this presentation was built, Vaccines 101, information from WIC staff, or for WIC staff, is found on that website. The next website is immunize.org. They have handouts. They also provide a great newsletter that goes out regularly with the most up-to-date immunization information. Local health districts, so Southern Nevada Health District, Washoe County Health District, Carson City Health and Human Services are all going to give county-specific events and resources. So those are always good places to check out for immunization information as well. As always, we indicate that the cdc.gov/vaccines is going to be your one-stop shop for all the most recent immunization schedules, in addition to their posters and printed materials. And lastly, Children's Hospital of Philadelphia, their Vaccine Education Center is world-renowned. They have printable resources that aren't specific to Philadelphia, but are broadly applicable to vaccine safety, vaccine age groups, and evaluating scientific information. So if you go to any of these websites that we listed, either on this slide or the last, you're going to find a multitude of resources. And that is the end of our presentation. So if you have any questions as to any of the content that we included in this presentation today, or if you would like for us to connect you with Dr. Pam Forrest, who discussed vaccine-preventable diseases and vaccines portion of this presentation, or if you have any questions about vaccines or resources in general, for Nevada, please feel free to send those to info@immunizenevada.org. We also put our website and our phone number on there. We're available on a multitude of social media channels as well. And again, we recognize the hard work that WIC staff does every day, and we appreciate the work that you do and the perspective that you provide. And we hope that you found this training useful today. Thank you so much for joining us, and we hope to see you in person soon.